times get hard, and we're here to help at NorthPoint.
Hello, welcome to NorthPoint's Making Health Happen. My name is Lisa Castile, your host for the program. Thank you so much for tuning in today. This series is being brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. And we want to provide you with practical tips and resources you can use. We will feature guests from our team here at NorthPoint and around the community to talk about the health and wellness issues most important to North Minneapolis. Together with our guests, our community, and you, our listeners, we are partnering to create a healthier community. Today, we're going to be talking about the issue of health equity. Joining us is Stella Whitney-West, CEO of NorthPoint Health and Wellness Center. Ms. Whitney-West has been at NorthPoint since 2004 and has been our CEO since 2007. Over the last 2 decades, Stella has led NorthPoint through huge changes, including $1 million campus expansion, doubling the size of NorthPoint's main campus facility, as well as the opening of several satellite clinic locations throughout North Minneapolis. Even before coming to NorthPoint, Stella had a long history of serving the North Minneapolis community. Her extensive experience in government and policy has been honored with several leadership and fellowship awards. The most recent one being the 2001 Minneapolis-St. Paul Business Journal Women in Business Award. We are thrilled to have her in the studio today talking about health equity. Welcome, Miss Stella.
Well, thank you, Lisa. I am excited to be here, and I must say that this is just awesome.
It is awesome.
That we have opened up our own kind of recording studio.
I know, right?
Right.
We are fabulous at NorthPoint. We make the magic.
We make the magic. We make it happen. You, Lisa,
Yes.
Jason, Sherry, right?
The team.
The team.
Yes.
The team. You guys are awesome.
Well, we are going to be talking about health equity today, Miss Stella. So I'm going to ask you, can you explain to us what health equity is?
Yeah, so health equity really, and I'm giving it a little spin on my definition and then what the textbook definition is as well. So health equity means that everyone has access to health care, based on what they need. And it's not based on your gender, it's not based on your income, it's not based on your life circumstances or where you live, but that health equity says that health and access to health is a right. It's available to everyone.
Okay.
And there doesn't need to be anything else other than the fact that you have access and that you have the right to be as healthy, at optimum health.
Okay. All right. Well, that breaks it down. Yeah. So we've come out of COVID-19, but we learned some things about health equity during COVID-19.
sure did.
Can you talk a little bit about that?
Well, what COVID-19 did was it exposed, it's kind of like when company comes over, and you think that you have done everything just right and everything is looking good, you've cleaned.
Yeah.
It's usually the children.
The children?
That will expose something and they'll find something. And you're going how did you find that? I didn't put that away. So what COVID-19 exposed in a really broad way was the inequities, the racism in healthcare, the access to healthcare based on income, based on community, because COVID-19 was the type of pandemic that we had not had to deal with in decades. And so one thing about COVID, the virus, it did not discriminate.
Yeah.
Right?
It leveled things.
It leveled things. It did not matter, right? But because the way our system was set up, it did matter in terms of who had access, and even how we even approached the virus as it and I'm going way back to the same as when HIV and AIDS, right?
Right.
We tended to identify it as with the gay community, and we totally, did not even pay attention to the science. That it did not matter anything other than the fact that it's transmitted through sexual activity, it's transmitted through blood-to-blood contact. So it had nothing to do with anyone's sexual identity.
Right.
But yet, because of our own inequities and how we define people, we tended to do that when it came to illness and disease.
Okay.
And what did it do? It caused us to have a crisis of our own making.
Yeah. So COVID came to the house and we learned some stuff, right?
We absolutely
Yes.
did. We
Big
absolutely
expose. So some of the barriers that we identified, can you talk about that a little bit?
Yeah. So one of the barriers for sure was that, first of all, we didn't quite understand, how it was being transmitted. I remember when we closed down. The county closed, the offices closed, and that was different.
Yes.
That was different for us. We didn't quite understand, how it was being transmitted, what the risks were. So there was just that fear, right? And so people were sent home. But what tended to be, I would say, healthcare as usual, that the people and communities that were most impacted were those communities that had the least amount of access to economic, health, housing. So it was those communities, predominantly communities of color, and the communities that NorthPoint serves, right?
Yeah.
And so the other thing that we learned, and I tell people about this, is that NorthPoint, because we are a federally qualified health center, when the vaccines became available, as a federally qualified health center and part of the federal government, we received some of the early distributions of vaccines.
Sure. You touched on something I want to spend a moment talking about, some of the important issues that impact equity and health. Can you tell us a little bit more about that?
Well, yeah, and particularly in this country, we have put a price tag on health. And you think about it, it should not be that your access to health should not be dependent on how much money you make or what community that you live in. Because the thing about health, and again, this is one of the things that we learned about the pandemic, when a virus is spread through the air, doesn't matter, right?
Yeah.
But what we have done in this country is that health and health care comes with a price tag. So those who have access to the best health care, right, are those that have the money and the means to do that, right? But when you think about that, health and wellness is something that should be available to everyone because it impacts everyone. If you have a cold right? Doesn't matter who you're sitting next to, how much money they make or don't make, right? You are putting that person at risk of transmitting that cold just
Yeah.
because it's transmitted through the air,
Right.
right?
Right.
But yet, in this society, everything is based on, right, your income,
Right.
your standing, where are you, or how people perceive you to be.
Wow. Yeah. So price tag on health. So what are we doing here at North Point to impact that? How are we making health equity possible here? What are some of the things?
Well, a couple of things. First of all, I would say one that I'm really most proud of that makes us unique is that the people that are in charge, our board, the people that I report to as the CEO, are the actual community, the people who are the recipients of the health care. They're the ones that are in charge. That's huge. That's a big difference. So when decisions are made in terms of what we are going to make available, how we're going to operate, the decision is being made by the people that we serve.
Yes, the
So
ones most impacted.
the ones most
Yes,
impacted, right?
yes.
And you think about it, it should be that way across the board, right? If the people that you are trying to reach or the people that are most impacted should be the people that you consult with. They should be the people who make the decisions.
Yes.
But that's not the way it is here in this country, right? It's usually the people that, somehow have been designated that they are in charge. And
Right.
normally it's based on how much money they have
Sure.
or what their quote unquote social political standing is.
Sure,
And it has
sure.
nothing to do with the need. Who has the
Exactly.
greatest need for it?
Exactly.
That's the difference with North Point. Number one, the people who are the ones who are receiving the service, the community, they're in charge. They make the decisions.
They're empowered.
They're empowered. They're empowered. When they come in, they see themselves, right? So the community, when it comes in, they see themselves in the staff. They see themselves in the artwork, right? They see themselves in the languages that are being spoken and how they are treated and respected. Makes a huge difference.
And this issue this topic today of health equity, this is one of our pillars of care,
Absolutely.
right? This is a foundational principle here for us at North Point. We are really focused on that.
Absolutely. The other thing is that we connect with the social determinants of health. So what that means is that what really determines your health outcome is above and beyond just what happens between you and your provider or what, but it's also based on your job, your income, housing, neighborhood, your friends, the social connectedness. Those are the kinds of things that they call those social determinants of health. And they have a major impact on someone's overall health outcome, right? And so here at North Point, we focus on that. So not only do we have this amazing clinical services that we provide, medical, dental, behavioral health, but those, what we call those social determinants of health, access to food, right? So we have a food shelf, a large food shelf on our campus where you have access to healthy foods, fruits and vegetables as well. We also have our whole programs, our human services programs for housing support. And also our community health workers we were one of the first organizations to embed community health workers as part of our team. And what community health workers, they are the folks who are from the community. They have a history with the community, and so they help to connect the healthcare providers with the community and understanding the culture of a community.
Right.
And oftentimes the culture of a community, unless you are from that community, you may not understand or even see, those little nuances, those cultural kinds of things, or the
Yes.
way of doing,
Yes.
right? That every culture or every community has. But when you bring in people from those cultures and those communities, as in community health workers, they are the ones that have that impact. So when we are out in the community and we are delivering health messages,
Yes.
to have it being delivered by those community health workers. And not only that, community health workers know where they need to go
Sure.
to deliver
They're
those
the
messages.
experts. Yeah,
They're the experts.
They're those trusted messengers in our
Trusted
community,
messengers, right,
Yeah.
right, and the community sees them as that. Oh, it's like, oh yeah, I know
Right.
Lisa, right?
Yeah.
She grew up here,
Exactly.
and then what Lisa tells me, I'm gonna believe it because I know her,
Right.
I know her family.
Yeah.
That makes a difference.
Yeah, I've got some street cred,
Got-
right? There you go.
You got
there
street
you go.
cred, and that entails also that you allow the person to tell you who they are, because so often,
Yes.
right, and we're all guilty of this, right, is that we will make assumptions about people
Yes.
based on what they look like, how they talk, how they dress.
Yeah.
And instead of just asking or getting to know them, right? And that's really key, because if you are going to provide and treat the whole person, how are you going to know who that whole person is if you don't make room for them to feel comfortable enough to tell you who they are, right?
I love that.
Right?
I love that. So that's one of the, that's one of the things I want to ask you about too. So for our listeners, how do we advocate for ourselves in these situations? I love that you said we're making room here at North Point. But if I'm someone who's dealing with some type of health issue and I don't feel like I'm being heard, what are some ways that I can advocate for myself?
Well, I think it begins with, I would say, even the staff that we have on our call center, because that generally is the first point of contact that people have. They're calling in to make an appointment to see someone, right? So the call center staff, how they are able to engage you right away in the
Sure.
kinds of questions that they're asking,
Okay.
so that they can make sure that they are matching you up with a provider or someone that they think is going to be a good match for you. And I think what's also key is that people should feel empowered to ask for what they want. If you prefer a woman, then you should ask.
Sure.
You should say, yes, I would like to have a dentist that is a woman, or I want a behavioral health provider. Maybe I want someone who understands gay or bisexual community. So we want people to be able to advocate for themselves in that way and ask specifically
Yes.
what is going to be the best fit for them. Because when you think about it, we see people when they're at their most vulnerable.
Right.
And when people feel vulnerable, they shut down.
True.
Right? They
Yeah.
come in,
Yep.
and there's a fear. We all know it, right? When you come in, you're like, okay, these are people who are going to see me naked.
Yep.
They're going to, they're going to give me a shot, or they're going to hurt me or something like that. So people are already at a disadvantage.
Sure. Sure.
Right? And so I'm really proud of the fact that our staff understand that.
Yes.
And they can put people at ease.
Yes.
Right?
They're
And
equipped. They're
It's-
equipped to meet people where they are. I
meet
love that.
people where they are.
Yeah.
And more importantly, letting them know that they're the most important person.
Yes.
Right?
Very
It's
important.
like, right.
Yeah.
So, and before you know it,
Wow.
if you're interacting with someone like that, you're telling them everything.
Yeah, and
right?
your shoulders come down.
Your shoulders come
You
down.
feel like you can open up.
You can open up.
Yes.
Right.
So let's talk about that trust piece for a second. This is one of the last questions I have for you. Is this building of trust in our community? We've been here for how long?
Over 55 years.
55
56. I think we're on our 56th year.
Wow,
Yeah.
56 years.
Yes.
That is a lot of trust that's built up
Absolutely.
in the community.
Absolutely.
And one of the ways that we do that is, we have some programming, right, that we take out in the community. We have some events, some things of that nature. Can you talk a little bit about that?
Oh, yeah, we have a lot of it. So one of the things that's so important is that we are out in the community. It's not just okay for us to sit in these walls,
Yeah.
but that we go out into the community. So some of the events, and one that I think is probably the most popular, at least with my grandchildren, is Fit for Fun.
Oh, yeah.
All right, Fit for Fun. And it's so much so, I mean, they've been involved in it since they were little, that my youngest granddaughter, she heard me talking about that, that I worked at NorthPoint, and she said, Gima, you don't work at NorthPoint, you work at Fit for Fun. Because for her,
Oh,
NorthPoint was Fit for Fun.
yes,
So
it's the same.
It's like, exactly.
Yeah.
But our Fit for Fun event was something that the staff came up with,
Okay.
right? It was a way for us to be in the community, to actually bring to the community different ways that they could be physically active, right? We had food demonstrations about healthy food. I mean, you can tell people, oh, yeah, well, I need you to eat healthier.
Yeah, yeah.
I need you to do that. I need you to eat more vegetables. Well, what we had at Fit for Fun, we had demonstrations, we had examples so that people could, and more
Yes.
importantly, that their family, because sometimes if you are the cook of the family,
Yep.
right, and you're trying to prepare healthier meals, there's like, nah, I'm not eating that.
Yeah.
What is that? It looks too green.
Right,
But
exactly.
opportunity for them to taste it and
Sure,
see it.
sure.
So those are the things that we did.
That exposure.
That exposure.
Sure.
Exposure.
Yeah.
We had a 5K, and I know we're going to get back to that.
Yeah.
We had a 5K walk run, and it was wonderful because we did it in the community.
Yes, yes.
And I remember comments that people said was that they didn't realize how beautiful North Minneapolis was, or that
Exactly.
the houses, how
Yes.
large they were, or how
Yes.
beautiful.
Yes.
Because, North Minneapolis has, gotten this kind of reputation.
Yep.
And so people just automatically
They just
think of
write
that.
us off.
Write us off.
Yeah.
And so Fit
Yes.
for Fun allowed people to be able to explore and get to know North Minneapolis community as we know it, as a wonderful, beautiful neighborhood
Yes.
community.
A
that has
united community,
United
too.
community.
Very united around
Right.
things. Yeah.
Exactly,
I think the
exactly.
first time I met you, Miss Stella, it was right after the tornado.
Oh.
And you had worked with that group. It was the NCRT, the Northside
Right.
Community
Community
Response
Response
Team. That's
Team.
right.
Right.
And that was an amazing example of the strength and resilience in our community and how everyone came together. you know. And that's when I
Absolutely.
first really started looking at North Point and thinking, wow, that would be an amazing place
Oh,
to dedicate myself to, you know. So it's an honor for me to be working here, and your leadership is just
Well,
so
thank you,
amazing.
Lisa.
So amazing.
and you fit
Yeah.
right in. Look at you, just good.
Well, I think I'm out of questions, Miss Stella. You're an amazing guest on the show. Thank you for being here today. We appreciate you and the legacy that you built here on our north side. Just wonderful. Thank you.
Well, you are so welcome, Lisa, and you are an excellent host.
Thank
You made it easy. And I always say, and this is important for all leaders, for all people to know that you are standing on the legacy and the shoulders of people that came before you. And you should always honor that. And you should always carry yourself in that manner. Sometimes people want to walk in as if they created the earth or they create. It's like, no, that's not how that works.
Yeah.
You're standing on the shoulders and the legacy of those that came before you. And you need to honor them. And if you honor your ancestors, guess what? You will be honored as well.
Wow, that's part of that secret magic you've got going on over there. All right. Well, thank you so much.
Thank you, Lisa.
right.
This was fun.
Thank you for listening to this week's Making Health Happen. We want you to know that we're here to partner with you and to help make health happen in your life. To learn more about NorthPoint, call us at 612-543-2500 or visit us on the web at northpointhealth.org.